It is truly an honor and a great joy to introduce this year's Irving J. Selikoff Awardee for the Asbestos Disease Awareness Organization. Dr. Henry Anderson, known to his friends as Andy, has been a leader in the field of studying the hazards of asbestos, adding to the literature, and doing so much more. I had the privilege of getting to know Andy when we were both training with Dr. Selikoff in the mid-1970s. So we've been friends and colleagues for a very long time. Andy has published important work in the area of asbestos, including studying the effects on household exposure. But importantly, he's also worked at the federal level, looking at asbestos issues for government committees, and has been active in his home state of Wisconsin as an occupational epidemiologist and working as an epidemiologist in the state, and has also continued to serve for many years for other important CDC committees. So it is with great joy and pleasure that I introduce as this year's Irving J. Selikoff Awardee, Dr. Henry Anderson.
Thank you very much, Arthur, for your kind words of introduction. It gave me an opportunity to think back over the years that we've all worked together on all sorts of different issues. And again, the ADAO group has been one of those organizations that's hung in there dealing with the asbestos issues as they developed over time. I was just remembering back to when I first went to start my research work with Dr. Selikoff in 1973, and we sat down, or I sat down with him to go over what am I going to do during my 3 years of residency. And he basically kind of went through what it means, or what he saw, what it meant to be a research scientist as well as a clinician. And then one of the key things that he raised with me is he said, if you really want to get into prevention and occupational environmental medicine, you have to not just do the research, find the problems, publish them for your colleagues to read, and then move on to something else. You really need to do the follow through to see that something happens, to utilize the data and the research you develop. So early on in the first weeks as I was there, he said, and much research begins with clinical observation. And at that point, he handed me a folder on a young woman, a daughter of a UNARCO worker who had developed mesothelioma. That was the start of my interest in household exposure and environmental exposures to asbestos, which throughout the years I've continued to work and research on. But he also said, well, you really need to understand what the legislative business is and how rules and regulations are made. And he actually sent me for 3 weeks out to Washington to work with Shelley Samuels and the AFL-CIO as they were finalizing the work on the OSHA asbestos regulations. And I really learned on the sausage process and worked very closely to see how the union individuals and Mr. Samuels moved forward on that legislation. And since that time, again, Dr. Selikoff said, you really need to be involved with the regulatory community. It's not always fun. It's not always gives you advancement in an academic or other type of work that the research publications would do. But rather, he said, you need to be involved. And since that time, I've actually been involved with volunteering for various committees and served on many of the research review committees for EPA, CDC, Department of Labor, and others, and National Academy of Sciences, looking at a variety of occupational and environmental issues, and specifically asbestos. Began with the OSHA regulation in 72, 73, and now I'm involved. The last one was with the SAC committee on the by EPA TSCA review for the what has turned out, fortunately, to be only version 1 of their approach to asbestos on the environmental side. And now we're into version 2 that will come up for review shortly. So it's been involved throughout the time, and I got to really give great praise to ADOA and especially their pushing of the Alan Reinstein Ban Asbestos Now Act over the years to begin to realize that we really need to move the U.S. forward. We've addressed a lot of the issues, but there are many that are still out there, and cases continue to occur that need technical scientific support. And I have to say, I'm really proud to have been selected by ADOA for the Selikoff Award in 2023. And I look at the list of prior awardees, I really feel honored to be included with some of the great names, including yourself, Arthur, on that list of who have had the reward. So I'm really pleased to be included with all those great minds and researchers, as well as advocates for workers and both environmental and occupational health. So once again, thank you very much for giving me the award. And I'm sorry I'm not going to be able to be in Washington to talk with everybody and have dinner and enjoy the conference this year and meet with some of the old guard that have been around a long time. Thank you very much.